If you're gaining weight around your midsection, you're losing your muscle, your brain fogged, you don't have that extra oomph, you could be heading towards menopause or in menopause. And guess what? Medicine is not looking out for you.
Some women are more predisposed to significant weight gain, and we have testing now that is available to help women understand and navigate menopause. Like, what symptoms am I going to get? What can I expect? It's called the Menopause Biotype. It's like a 23andMe test. So if you want to know what can I expect, that's a great resource.
Dr. Jennifer Berman is a renowned urologist, sexual health expert, and women's wellness advocate. She is one of the few female urologists in the United States that has pioneered research around female sexual health. Dr. Jennifer Berman comes on the show and gives us the exact medical insight on what women need to do to be your happiest, healthiest version of yourself as you hit menopause. All right, Doc, thank you for coming on the show. Before we came online, we were having a conversation and you said something that still stuck out to me. And it's like, I'm still thinking about it, that you said, after a woman has a baby, sort of the medical industry kind of just forgets about you. What did you mean by that?
Well, from the standpoint of the symptoms that women have as they age, once we're done having children and we're entering into perimenopause and menopause, meaning symptoms are starting to crop up, moodiness, fatigue, hot flashes, night sweats, weight gain, sexual health issues, vaginal dryness, and low libido. Those are symptoms of hormone imbalance that are not at this time recognized by the medical community as warranting medical attention or medications or intervention. So when women come to their gynecologists or their primary care doctors or their family or their internist or whoever and talk about these symptoms, they are met with, I don't know, or they're given antidepressants, or they're told to do, have a glass of, they're dismissed.
Yeah.
And the reason for that is that the medical community, such as our OB/GYN obstetricians and gynecologists, are not trained. There's no algorithms, there's no protocols that exist today out there in the medical field for treating perimenopause and menopausal women. I don't know if you remember back in 2010, there was this big outcry, basically, that there was the Women's Health Initiative study was published, and the ACOG, the American College of Obstetricians and Gynecologists, released this information. And at the root of it, it was hormones are bad and hormones cause breast cancer. And everybody needs to stop hormones right now. So women that were on hormones were getting yanked off, and women that were, and there was this big scare, which, by the way, was completely unfounded. They had to recant that statement, and it was not true. It was not based on that. The opposite is true. However, they never came out with anything else. So it left all of the gynecologists practicing, all of the new ones coming out without any leadership, without any guidance, without any direction. So then what do women do? Where do they go? So then they have to go out of network. They have to find other doctors. They have to search around to find providers that understand and know hormone replacement therapy. I happen to know, like, I've been working in this field since the 1990s, for decades. And I'm a woman, obviously, and my specialty, I'm a urologist specializing in sexual health. But through the course of as I'm aging, in the course of my career, as I'm aging, I'm noticing changes in my body. I'm getting hot flashes and night sweats and mood and low libido. And I'm reaching out to my gynecologist, and nobody knows anything. So I literally had to learn myself through other doctors in Europe. There was nobody here in the United States really talking about it, but in Europe and Canada, there were other doctors that were treating women with testosterone and optimizing hormone balance. And that's kind of where I learned, and I became my first patient. And from there, I started treating other patients. And from there were more women. But that's kind of the situation that we're in right now here in the United States with dealing with aging women. Our doctors aren't trained in menopause. And what we're seeing is all this media attention coming out with new publications and new articles and new things. The research is happening, but yet where do women go? So that's, you know,
Yeah, that's a state of affairs here,
yeah.
basically. Okay, so a few things. At what age does a woman hit menopause? A woman hit menopause? What happens? What are the main symptoms of menopause? And when we talk about hormone replacement therapy, I want to go into how safe it is.
Okay. So prior to menopause, I want to just mention there's perimenopause. So these are women in their mid to late 30s, early 40s, and that's when symptoms can start. And that's when symptoms often get overlooked, dismissed, or mischaracterized. I don't know if you remember seeing in the media recently, Halle Berry was misdiagnosed. She's menopausal, not even perimenopause, but they misdiagnosed her menopause as having herpes. She was having vaginal dryness, painful intercourse. And instead of recognizing that she had vaginal dryness due to low estrogen levels, they told her she had herpes, and that was plastered all over. I remember that. So in the perimenopause, when women start to develop symptoms of moodiness, difficulty sleeping, weight gain, some vaginal dryness, maybe low libido, that's the beginning of menopause. Now, the only difference between those women and the actual menopausal women is one thing, is as the perimenopausal women are still having their periods. A menopausal woman, the definition of menopause means you haven't had a period for 12 months. So if it's been 6 months, if it's been 8 months, or if it started and stopped, you're still technically perimenopause. It's just a definition that when your period ceases for a period of 12 months, that's the definition of menopause. And but the problem is that women in perimenopause have the same symptoms, maybe not as worse, maybe not as bad, maybe not as profound, but they're still having symptoms. And those women are definitely right now in the United States not getting treated with, and should be treated with, hormone replacement therapy. The menopausal women who haven't had a period in 12 months, who have the same symptoms, hot flashes, night sweats, difficulty falling asleep or staying asleep, memory, focus, concentration changes, they're foggy thinking, they can't remember things, they're feel less creative, less motivated. They're not the same as they were. They're not functioning on all cylinders. They're not able to compete in the workplace with men and other people due to hormone imbalance. Not to mention vaginal dryness, painful intercourse, low libido, joint pain, and weight gain is the big one. So all of those are that can vary, and every woman has some semblance of those symptoms, sometimes worse than others. And there's a genetic predisposition to symptoms. Like some women are more predisposed to having severe hot flashes. Some women are more predisposed to significant weight gain. And we have testing now that is available to help women understand and navigate menopause. Like, what symptoms am I going to get? What can I expect? It's called the Menopause Biotype. It's like a 23andMe test. So if you want to know what can I expect, that's one option that's a great resource. But perimenopause and menopause, these are the symptoms, and it's just a consequence of aging and the changes that occur in our bodies. And when hormone replacement therapy, I'm a huge proponent for hormone replacement therapy, and we talk about safety. The concerns that we initially had, originating back, about 10 years ago, when they released the Women's Health Initiative study saying hormones are bad, hormones cause breast cancer, that's been completely debunked. In those studies, they were looking at synthetic estrogen plus synthetic progesterone in the form of Prempro. It was an oral medication, actually. And oral hormones or oral estrogen, in my opinion, now is completely passé. Nobody should be doing estrogen orally, because when you give estrogen orally, that's when you do have the potential risk, and not necessarily cancer risk, but thromboembolic risks of stroke and heart attack and things like that. When it's given transdermally through the skin, you don't have the thromboembolic events. So there's not concerns about stroke, or not concerns about cardiovascular disease, or raising your cholesterol and things like that. The other concern was breast cancer. And that was with, again, synthetic estrogen plus synthetic progesterone given orally. Today, we're not using synthetic estrogen and synthetic progesterone. We're using bioidentical estrogen and bioidentical progesterone, which does not have the same risk factors. And when they went back and teased back and reviewed the data again, really even with the synthetic progesterone, what it comes out to is that in some women, in a small percentage of women, after 7 to 10 years of consecutive use, there is a slight increase in breast cancer, but not the preponderance of what they originally discussed. However, what we do know now that we didn't know then is that testosterone, which, by the way, is equally important in women as it is in men. Everyone thinks that that's a male hormone because, testosterone makes you strong, whatever. But it is extremely important in women as well, and declines significantly with aging and leads to a lot of symptoms also. What we know now is that testosterone is protective against breast cancer, literally prevents breast cancer, prevents the recurrence of breast cancer. If you've had breast cancer, prevents you from getting breast cancer if you haven't had breast cancer. And that is a fact. That's known. We also know now that estrogen prevents degeneration, cognitive decline with aging. Women's brains shrink during menopause and estrogen deprivation. Our brains actually shrink. So when women say, I just feel out of it, I feel stupid. I feel I can't remember anything. I feel like I'm not, productive anymore. There's reasons for that, and it's hormonal imbalance. So, in my opinion, in order to remain, and if we're talking about well-being and longevity and health, everything starts and stops with hormone balance. As soon as we start to, our ovarian function, adrenal gland function starts to decline, in my opinion, it is when we start to really age and die. So now today, with advances in modern medicine and technology, we have ways to prolong our lifespan and prolong our health, and do so not just live sick, but live with well-being and live with health and prevent disease. So why do you want to start? So why would a perimenopausal woman want to start hormone replacement therapy? In addition to alleviating her symptoms and making her feel better, it will prevent disease, prevent Alzheimer's, prevent osteoporosis, prevent breast cancer. So improve your cardiovascular health, improve your strength, improve your cognitive function. So it's a no-brainer for me. And the risks and side effects that we're talking about is not cancer, death, stroke, the side effects of hair growth, oily skin, acne, some breast fullness, tenderness, all things that are manageable and reversible. We're not killing people with hormone replacement therapy, which is what, the mindset is right now. Oh, that's dangerous. It's bad. Right. Or there's just confusion and uncertainty and unknown. So if we don't know it or it's bad, that's kind of the ethos that the medical community has, and then that scares consumers. But what happened during COVID, this is when I first started to change. So we have social media now that we didn't have back in the day when I started. And women were talking to other women, and they were seeing, I think Kris Jenner or one of the Kardashians got on TikTok. The mom was talking about like this menopause. And then it like, whoa, like we're talking about it. Like, and there's also shame and taboo. Like the word menopause is symbolic of, the withering of your fertility. I'm no longer feminine. I have patients, a lot of my patients are the housewives of Beverly Hills. And I kept telling, I was like, you should talk about this. And they were like, no, I don't want anyone to know that I'm menopausal. And now, so that was, 3 or 4 years ago. Now they're 3 or 4 years older. And now they're reaping the benefits of hormone replacement therapy. And now they're realizing that they have a platform that can impact, that is beneficial, that can provide women with help and resources, tools and information. And they are starting to talk about it. So this movement that's happening around menopause is women, it's not driven by politics. It's not driven by the FDA or the medical community. It's being driven by women, the consumer. And they're starting to, get louder. and there's starting to be, more prominent voices involved, like Huberman Lab has covered it. And there's Mel Robbins. I don't know that. So these larger podcast, you are covering it. And I think with the more conversations that we're having, more awareness that's developing, and male voices chiming in, that hopefully change is on its way.
Yeah, big time. I've seen the benefit of bioidentical hormones on patients years ago, and how much better they do. But for those who've never heard of them, what are they? What's the difference between like the synthetic ones that they were talking about in the 90s that go, you take this, you're going to get breast cancer or a thromboembolic event or something like that. And the delivery is through a lotion or a patch. Like how easy is it? Do they need a prescription? And basically the women listening, how do I get my hands on bioidentical? Let's talk about something that affects us all. It is the impact of artificial light, especially at night. A lot of you don't have your blue blocking glasses at night, and this is really important to talk about because we're constantly surrounded by screens and LED lights that emit harmful blue light, and it's disrupting our natural sleep cycles. And it's actually potentially causing eye strain and fatigue. But don't worry, we got a little solution for you, and it's stylish. I love stylish and scientifically backed. Ra Optics is the world's leading brand in blue light protection wear. Those aren't your average blue light glasses, not the ones you get on Amazon for really cheap. You want ones that are quality. Ra Optics has collaborated with the top experts in optics and photobiology to create lenses that actually work. Now, what sets Ra Optics apart is their commitment to effectiveness and style. They've managed to block out the most damaging wavelengths of light while still maintaining vision and color perception. It's like giving your eyes a break without compromising the look. Now, I know some of you might be skeptical about whether these glasses really make a difference. They do. I've been using them for years, actually. But Ra Optics partnered with Aura, that ring that people wear? And this is the company behind a lot of those popular sleep tracking rings. And users who wore Ra Optics sunset lenses before bed saw a noticeable improvement in their sleep quality. That's some solid evidence right there. But it's not just about better sleep. Wearing Ra Optic glasses helps resync your body's rhythm with nature. One of my tenets for overall health is being in sync with nature. You have to be healthy. It means you can feel more energized during the day while generally feeling better. It's like you're hitting the reset button on your internal clock. And if you're worried about looking dorky, don't be. Ra Optics are so stylish. They're wear by celebs and top athletes. You'll be protecting your eyes and looking good doing so. So if you're tired of feeling tired, a lot of you are. Dealing with eye strain, a lot of you are, especially if you're in front of the computer all day. You go to raoptics.com/DRG. That is raoptics.com/DRG to get your pick. I'm someone who prioritizes clean, pure, high quality ingredients in my life. You all know I'm super picky about the supplements I take, especially when it comes to something as important as omega-3 fatty acids. And from the oceans being polluted to even the fish we eat being contaminated with heavy metals and other nasty stuff, being particular about the source of my omega-3s is super important. That's where Priori comes in. Priori's O3 Ultra Pure Fish Oil is my go-to for getting a premium potent dose of EPA and DHA omega-3s. What I love about Priori is they are committed to purity, potency, and transparency. Every single batch that they produce is tested by third-party labs against 200 different contaminants. So I know I'm getting something that's incredibly clean and pure. In fact, the Priori O3 is certified by the Clean Label Project and has 5 out of 5 star rating on IFOS. That is the International Fish Oil Standards Organization for purity and freshness. And get this, every single bottle of Purity O3 comes with a QR code. You can check specifically the test results for the batch in your hand. I mean, how transparent does that get for a company? It really gives you peace of mind knowing what you're putting in your body. I know that's where I'm at when it comes to supplements, especially fish oils. I take it for my heart, my brain, my eyes. I don't worry about any of the nasty fish burps, any rancidity, any oxidation. I'm good to go. If you're looking to add a premium, pure, potent omega-3 supplement to your routine, I cannot recommend Priori's O3 enough. It has become an essential part of my daily health regimen, and I think you're going to love it too. Priori's offering 20% off of their O3 Ultra Pure Fish Oil and all their other fantastic products to Heal Thyself listeners. That is 20% off, even on top of the already discounted subscription price. Just go to Priori.com and use the code DRG for 20% off already, the discounted subscription price. That is PUORI.com/DRG. Use the code DRG.
So all bioidentical means bioidentical is the same as your body makes. So the same molecule that your ovaries make. So 17-beta estradiol is the estrogen molecule, and it works on the estrogen receptor. So there are bioidentical hormones right now for women, only estrogen, the only one that is available, well, there's two. There are two hormones, that at least the ones that I use, that are bioidentical, that are commercially available, that are FDA approved, that can be prescribed, that you can get. 17-beta estradiol comes in the form of a patch, and progesterone, micronized progesterone, is the same as our body makes, not Provera, not the synthetic progesterone, but regular progesterone, is also commercially available and FDA approved, and comes for menopause and comes in 2 doses. Testosterone is not FDA approved yet, despite all that we know about the beneficial effects in terms of cognitive function and breast cancer and everything else. Still not FDA approved. And so what that means is that has to be compounded by a compounding pharmacist, and they can make testosterone in a lot of different versions in the form of patches, creams, lozenges, troches, pellets, lots of different ways that can be delivered also transdermally. The problem that exists now related to testosterone, I was just telling you about how doctors aren't trained, like our medical providers aren't trained in just estrogen and like regular hormone replacement therapy. Testosterone, like, is basically, we're in the dark ages when it comes to women in terms of that. And the reason for that, I'm not really sure, because I've been treating women with testosterone since the 90s, and there were many doctors that were doing research with testosterone in women well before I became like decades before I started doing it. So, and now with the preponderance of evidence of the beneficial effects, it makes no sense to me why we haven't pushed forward further. But testosterone is tricky because, and if doctors aren't trained, they don't know, like, well, what should the levels be, or how high should they get, or how do we give it, or what, and I don't know about you, but for me, if I don't know how to do something and I don't feel comfortable with it, I'm not going to do it.
Right.
I'll be like, either refer you to somewhere else, or be like, and that's what's happening. Nobody knows how to do it, and they don't, and they refer to somebody else, and women are left flailing around, having to become resourceful themselves and find providers out of network and provide this and do the research themselves. That's basically, and where can you go? Where do you go to get bioidentical hormones? They do have to be prescribed by a medical doctor that obviously knows what they're doing. And many do, and many are learning. So just because your doctor may not be certified in in hormone replacement therapy and be an expert, what they're doing now is doctors are taking matters into their own hands. If they're not trained, they're taking courses, they're shadowing other doctors, they're learning and reading and doing what I did back in how I had to do it. They're starting to try to educate themselves and try. But what happens with that is that patients can tell, like, I'll try this cream, and the doctors will believe that it'll help you, but they don't. Well, let's try this and let's try that. And if the patient doesn't feel that you have an authority and that you can say this is going to happen, because these patients come to me and they say, well, she helped me, but she didn't test labs, and she said, she didn't know, she wasn't like, maybe, and it just made me feel nervous. So that's kind of the sentiment that women, the consumer, feel either confusion or anxiety about hormones. And the reason for that is that our doctors aren't trained. And so when they find one like me or you or whoever that understands, it's a huge relief. And then they tell their friends, and then they tell their other friends, and hopefully little by little things are going to start to improve. But bioidentical hormones are safe and effective. They need to be, under a doctor's supervision. There are levels that need to be checked and levels that need to be maintained. And there are risks. I'm not going to say that there's it's like drinking water. There are potential risks, which is why, it needs to be under a doctor's supervision. But the cool thing is now, even women with breast cancer, back in the day when I was coming up and becoming menopause, it was unheard of. Like, even giving vaginal estrogen to a woman with breast cancer. And those women really suffer. They're put on tamoxifen or raloxifene, and they're shriveled up hormonally into like frail, like no estrogen, thin vagina, brittle bones, like weak muscle, but they don't have cancer. Like I
Right.
say, oh, you don't have cancer, but quality of life is equally important as quantity of life, and that gets lost in the breast cancer patient. Now today, breast cancer patients are now able to use vaginal estrogen products, and we're even able to give breast cancer patients testosterone, because we give them testosterone plus an anastrozole. And anastrozole blocks the conversion of testosterone to estrogen and keeps it as testosterone.
Mm-hmm.
So even if they have breast cancer, estrogen positive breast cancer, they can receive testosterone. And testosterone helps with hot flashes, night sweats, memory, mood, energy, lean muscle mass,
Mm-hmm.
libido. And many, many, many women now with breast cancer are thriving and living active lives where before, they couldn't go windsurfing or they couldn't, go biking anymore. And
Yeah.
now they've got their lives back and their energy back and their sex life back, and they're cancer free.
Yeah, it's beautiful that that can be offered to women. I mean, I've worked a lot in breast
Yeah.
cancer. I can see how women degrade into this, like you
Hmm.
said, frail, in many ways, like lifeless. It's just
Yeah.
like, wow, there's no more oomph to that person.
They become a breast cancer survivor, and that's their identity.
Yeah,
Instead of I'm a woman, I'm Jennifer, and I'm
who's
like, yeah,
thriving, who's thriving.
yeah.
So I'm intrigued by the talk on testosterone because I hadn't heard much about testosterone being given with women, bioidentical hormones, women who are going through menopause. Um, the testosterone in itself, you said, still isn't approved for that.
Yeah, no,
So it has to be
testosterone in
compounded.
any format it is not FDA approved for use in women yet. And there is no explanation for that. Originally, it was they say about safety and
Yeah,
safety to the unborn fetus. But these are women that are not having babies
right,
anymore. They
right.
are menopausal women where there's no chance of a fetus, or like by the time they've stopped having a period for 12 months, they're not having babies anymore. So the safety issues related to that are nominal to none. And now we have an overwhelming body of evidence, not just talking about the safety of it. We already had that. And I was annoyed back then. Like, we have safety data. It's safe. Okay, guys, let's move it. But now we know not only is it safe, but it prevents breast cancer.
Mm.
So how can you, there's nothing. And so I don't, again, it could be political, it could be financial, it could be any
Yeah,
number of things. But what I do know now, professionally and personally, as a woman, an aging woman now who's in her almost 60, is that I am not competitive in the workplace without hormone replacement therapy. So the glass ceiling that we talk about that was set by corporate America, in my opinion, is not set by corporate America. It's set by menopause.
mm,
Because as soon as a woman becomes menopausal, we can't sleep, our memory's bad, we're foggy, we're not as assertive and aggressive, and then once that happens, you're not eager to take on new projects. So if you're working with a guy, let's say a 58-year-old guy, and you're 58, and nothing's happened to him, his memory's fine, his mood is fine, he's not getting fat and tired and all
mm,
that other stuff, but we are. And so without hormone replacement therapy, then we are not firing on all cylinders. We're not as assertive, not as aggressive, not as confident. And as soon as we realize that, then we're here. We're not equal anymore. With hormone replacement therapy, it allows me, because I'm that woman. I actually was 37. So it hit me. I was one of the women that was very sensitive to fluctuations in estrogen. Every woman feels a little bit. Some women worse than others. We know about postpartum depression,
mhm,
right?
mhm.
Those are the women that are really sensitive to it. When estrogen falls, they become,
Mm,
suicidal, homicidal, hallucinate. But that doesn't have to happen. For me, my estrogen levels fell. I wasn't suicidal or homicidal, although maybe I was a little homicidal, but I was
mm,
miserable and not able to function. Very, very angry, irritable, edgy, weepy, all of it. And I also have a very strong history of breast cancer in my family. My mother died of it. My sister, who's 4 years younger, got it twice. We don't have the BRCA gene, but I was advised highly not, do not go on hormone replacement therapy. But there wasn't a choice because I couldn't function. I was in the middle of my fellowship. I had to take boards. I was like, okay, I'm going to give up now. And so I did a cost benefit analysis. I knew what my risks were on compared to the general population. It's higher because of my family history. And I knew what the risks were because they can calculate it, with hormones, my risks were higher, but not like hugely higher, a little bit higher. And so I said a little bit higher, I'm willing to take that risk because I want to live. I want to have a life. And, I might get breast cancer is going to be for somebody else. So we're going to push that away. And so this is since 2000. So it was after my daughter was born. So 2003 is when I started this. Today is 2024. So for all of those years, I've been on hormones and testosterone. And back then I was giving testosterone to myself and other patients, and people were freaking out, like, oh my God, like, what are you doing? But honestly, I think that my being on testosterone is what prevented me from getting breast cancer. I thought like, oh, I just manifested myself. I was my positive thinking. Maybe it was both, but chronic testosterone over time, long-term testosterone use is now what they know prevents breast cancer. So it was just, I prevented myself from getting breast cancer through both ways, probably. But it's a testament to the safety of it and the efficacy of it. And, I'm a living model of that. So testosterone is really important for women for energy, mood, sexual energy, physical energy, and your emotional kind of joie de vivre energy. So those three forms of energy. And also cognitive function. While estrogen is more, helps with short-term memory and focus and concentration, testosterone is even a higher level of almost intelligence, creativity, connecting the dots. Like, if I were to tell you something and then you say like, what was that? I'm going to go look that up. Like that desire to go look it up goes away without testosterone. The even thought that, oh, that may apply to something else goes away. I notice it in myself when my testosterone levels start to decline. My son even notices it. I think you're due for your pellets, Mom. So it definitely impacts how we feel, how our bodies function, and equally as important, at least to me, is how we look. Our skin, our hair, our nails, our lean muscle mass, our weight, all of that is optimized through hormone balance.
I'm putting you onto my favorite green powder, period. New Zest Good Green Vitality. It's the best one out there. It's a revolutionized approach to holistic health. I'm a believer in whole body wellness, and I like efficiency all in one. That's what I want. And it's crafted with impressive blends of vitamins, minerals, superfoods. It's a true symphony of nutrients designed to support every aspect of your health. It bridges the gap between what you eat and what our bodies truly need. It provides comprehensive nutrition. The convenience factor is unparalleled. Imagine replacing several bottles of supplements with one good scoop of good green vitality. That's all. It simplifies life without compromising quality and nutrition. And from my own experience, it's been transformative. It's enhanced my energy, better digestion. My immune system is stronger. I didn't even get sick during the winter. These are just the benefits that I've enjoyed from Good Green Vitality. Plus, it's got a natural taste. It integrates effortlessly into my smoothie. And sometimes I'll just put it into water and it tastes great. Good Green Vitality isn't just a supplement, it's a commitment to your overall health. And I encourage you to embrace this path. It's a step towards nutrition in your body, mind, and spirit. You can get 20% off of all NewZest products by using the code DRG at checkout. Head to newzest.usa.com/DRG to learn more and start your whole journey towards whole body wellness with Good Green Vitality. Go to nuzest-usa.com/DRG. Use the code DRG for 20% off. So in a woman who's heading towards, she's in premenopause, heading towards menopause, testosterone is also going down with the estrogen.
Yes.
So we have to understand that because, there's women, they go straight to the bioidenticals without even thinking about testosterone. But for you, you're saying, bioidenticals and testosterone
Well, testosterone is bioidentical. So we're compound. It is
come
bioidentical
all together
also.
under one
All three of
umbrella.
them, estrogen, progesterone, and thyroid. Thyroid is another one that kind of and they're not becoming like hypothyroid metabolic disorder, but it's once the ovaries start to get out of balance, your adrenal glands have to kick in to compensate for that happening. And then they get tired and burn out for a period of time. And that's when cortisol levels rise, the stress hormones rise. So menopause, your metabolism in menopause is completely flipped around, upside down. You're storing fat as opposed to burning fat. You start to gain weight centrally. Women will say, I'm dieting, I'm exercising, I'm eating like 2 almonds a day, and I'm not able to lose weight, or I can lose a couple pounds, but as soon as I have like a bowl of pasta, I gain it back and more. And so their metabolism is shifting. And what happens is that menopause, in my opinion, is a risk factor for cardiovascular disease, a risk factor for metabolic disease, type 2 diabetes, a risk factor for depression and anxiety, and a risk factor for obesity, for just being unhealthy. So why we're not treating menopause and taking menopause seriously, just if nothing else, forgetting how women feel, but their health. Like, we haven't connected the dots that to remain healthy, we have to optimize hormone balance. And, it's just like somebody tore that chapter out of the textbook, or they erased it from our brains. It's very weird, because even now, like, I'll see, I just saw a patient the other day, an older woman, in her 70s, and she was having really horrible urinary urgency. I forgot to mention that. That's another symptom. Urinary symptoms, frequency, urgency, urge incontinence, leakage, or stress incontinence. They call those genitourinary symptoms of menopause. So this woman was having urgency, and urge incontinence that was like debilitating and driving her nuts. And she's seen all sorts of different doctors, neurologists, and she the last one she saw was a urologist from Columbia. So Columbia University was a very prominent university in New York, in the Department of Urology, which is my field. She saw a female urologist, a very well-trained one, who did an exquisite workup on her and diagnosed her with this urge incontinence. And they prescribed her with a medication for overactive bladder. So for somebody like that had a neurological condition, like with MS or a spinal cord injury or Parkinson's disease, none of which she had, to quiet the bladder. So it wasn't, which didn't do anything for her. And the issue, and it didn't occur to that doctor. I was like, why? Well, she was a urologist, so it's even less, but she wasn't a gynecologist. But why it didn't occur to her to say, okay, the urge incontinence is genitourinary symptoms of menopause. She needs vaginal estrogen. And so, so that it's women of all ages, even in the premenopausal women. Premenopausal women are on birth control pills. Okay, let's say, so birth control pills for many women can, because what happens in the birth control pill is that it dramatically lowers all of your hormones. If you're a young, reproductive, healthy woman, most of them, aren't impacted by that. But there are a handful. I'm not going to say few. I'm not going to say many, but somewhere between few and many. There are a lot of women that don't tolerate the birth control pills because of that, because it makes them moody, because it makes their vaginas dry, because it causes low libido. Why? For the same reason a menopausal woman struggles with it. So that's a lot of what I do too. So if a premenopausal woman can't take hormonal contraceptives, what do you do? What are the alternatives? So I do have premenopausal women in my practice too that are sensitive to hormone fluctuations in hormones, that need a little bit more, a little bit less, that need options for birth control, that can't take birth control pills. I had a young girl the other day that got the Expanon, the implant, who had everything, including bleeding, nonstop bleeding. And so we had to take that out and get her, so it's hormones are relevant regardless of what your age are, whether you're in your 20s, 30s, and 40s, or 50s and up. It's important to have an understanding of what they are. And in fact, I would encourage women to know what their levels are, especially when they're feeling good, to get your levels checked, to look what does my estrogen level need to be for me to feel good? I know what mine is. I know what hers is. So mine is, 242. Another woman's might be 80 or 40 or 60. We're all different. So just what works for me isn't necessarily what works for you. I think that's another thing that's fallen, that's been challenging for the medical community, because they want to do one size fits all.
Right.
Everybody gets this, everybody gets that. And if you can't do that, then, then it's bad, or then there's something wrong. And we can't do that with menopause. There's not a blanket, pill, just like what came up with female sexual function, female sexual health. There's not a little blue pill like Viagra that's going to fix women's sex lives. It's just, we're more complicated. And there's more factors and more variables, and our reproductive health and our brains are different, and our emotions are different, and how we process things is different. So it leaves a lot untold and a lot misunderstood. But there is the cool thing is that now today, women with social media and with the internet, women can take matters into their own hands. And there's a lot of information that's available online, and a lot of resources that are available online and through social media. And people are finding their way. They're finding their way to different doctors, to different providers, to different healers, to different groups, different educational forums that are talking about it. And momentum is starting to build. And hopefully, the medical community will follow. They have to. It doesn't feel good to have a patient come to you and be like, I don't know what to do. Like, that alone as a doctor should hopefully, it is. I see it. It is spurring them to learn, to do, to step out of their comfort zone, to, you can't be a gynecologist and not do hormone replacement therapy. It's like an oxymoron. It doesn't. So hopefully all of them are going to, the ones that are already trained are going to start learning, and that they'll start teaching the medical students, they'll start teaching the residents, they'll start being, it's impossible for that not to happen with the data and research that we have that's coming out.
The sexual changes, the libido, major one that a lot of women are suffering with. What's happening in the body of a woman, perimenopause, going into menopause, in menopause? What's happening to their hormones that they aren't feeling as sexual or sexually driven, or even during sex, not having the amount of pleasure and how much they enjoyed it? And does it come back to the same thing? Like, those are the women that really benefit from this hormone replacement therapy. And then is there an emotional component to it too? Do you find a lot of these women become depressed from this? Marital issues are starting to arise.
100%. Yeah. My marriage is in crisis. We have a lot of men that get their women in. My husband made this appointment. My boyfriend called. Yeah. So the thing at the root of like all of it, if I had to think of, like, if you off the top of my head, what is it that they say that's kind of universal? I don't feel like myself. I'm not myself. Whether it be from a mood standpoint that she's snapping at her kids and her husband, or be it from a sexual standpoint. I used to want to have sex all the time. I was multi-orgasmic. And this is not me. I don't know why this is happening. And from the standpoint of the emotional perspective, that was originally when I first started, in this field, we were met with a lot of resistance by the psychotherapy, the therapists and psychologists, and they were saying you're medicalizing a condition that is more emotional, relational. And it's both. In women in particular, I'm not going to say that men don't have emotions but men are much better at compartmentalizing. They can be, have these thoughts and feelings, but still focusing on the task at hand. Okay, right now I'm having sex, and I'm going to get her and I'm going to do it. And then I'm going to go over there and cry and whatever else. There are women that can do that too, but it's harder. And so their emotions and their thoughts and their feelings interfere with arousal and orgasm and libido for that matter. And it's important. So it's not to say there's medical issues and there's emotional and relational issues, and the two work together. But the point from my standpoint as a medical doctor, there are real medical, physical reasons why women have sexual function complaints that are amenable to medical treatment and that should be addressed. And there's also emotional and relationship issues and, that need to be addressed and attended to and thought about. And the two together, not either one in isolation is better, but need to be working harmoniously. And in terms of the other part of the question was testosterone. What was it?
Do the bioidentical hormones? Is that the answer then also for the libido part?
Yeah. So so what women will say, so estrogen is crucial for arousal, lubrication, engorgement, the warmth and tingling that occurs in the genital area, blood flow. Okay. And then testosterone is important for libido, your desire, the motivation to be sexual, the motivation to initiate sex. So your motivation to masturbate or whatever, to have sexual thoughts, interests, fantasies. And orgasm is also testosterone. I'm not going to say testosterone dependent, but impacted. But if testosterone levels decline, orgasm can be affected. It's less intense, harder to come by, cost benefit analysis of even having sex doesn't pay off. So is a frequent complaint that women have. So testosterone is essential for sexual function, arousal, orgasm, libido, all of it. And so when your physical energy, your lean muscle mass, so when testosterone levels are low, women feel apathy about sex. A lot of them say they're not, but they're not like disgusted, abhorrent, like repulsed, but it's sort of like apathy. And over time, if a woman is a widow or is divorced or whatever, over time, you don't even notice, you just stop thinking about it. And so she thinks she's fine and normal. And I have this patient, she's fine going about her life until, there's a guy and he looks, maybe I'll go to dinner. And then wait, now I like this guy. Oh, I'm starting to have some feelings. Maybe we'll have sex with this guy. And it's like, brakes come on. I'm dry. It hurts. I can't have it. Like, hell, what do I do? So, yeah. So
that's what sort of the experience is that you see, huh?
That is this very, and I guess to the point where the Menopause Biotype test comes in is that there are women, I'll say a small percentage of women that float through seamlessly without any hiccups. And, God bless those women. Most women suffer to some degree with something like weight gain or I can't sleep or I'm getting migraines and moodiness. The majority, really struggle with all of the hormones and navigating through menopause. And the thought was like, let's just get them through menopause. And then once they're done with menopause. So when are you done with menopause? Menopause, you're technically done with menopause and by our medical definition, when you stop having hot flashes and night sweats. So those eventually, if you were to do nothing, if I gave you no bioidentical, no nothing, and eventually you'll be miserable and your hot flashes and night sweats will eventually stop, but you'll still be miserable. So even though the hot flashes and night sweats stopped and you're not menopausal anymore, you're postmenopausal, you still have everything else. You can't sleep, you're fat, your bones hurt, you can't lift weights, you're moody and irritable, your vagina's dry, you've got no libido. All of that still, your bones are cracking and you're a mess. That continues. So I get asked a lot, well, how long do I have to stay on them? You have to stay on them. And then the demand increases. Like as you age through menopause, you might need a little bit more. And then as you become postmenopausal, maybe we can taper back down. But if you want to live a happier, healthier, sexually fulfilled life for the majority of us, not that small few, the lucky ones, but for the majority of us, it requires hormone balance, optimizing hormone balance into our 60s, 70s, 80s and on.
Yeah.
Men are doing it. We don't think twice about men jacking themselves up with testosterone.
Right.
50, 60, 70 or 80-year-old guys bench pressing, a million pounds and, wearing, cut
Cut off
wife
shirts.
beater
Yeah, wife
shirts.
beaters.
And,
Yeah.
they're, they turn into silver foxes and get better
Right.
as they age. Why do we have to, have the opposite experience?
Yeah, absolutely. There's women listening going, oh, wow, this is my experience and I'm heading towards there. What I'm hearing from you is they got to get their blood work done. And even if you're not heading towards there and you're feeling good, get your blood work done and look
Especially
at your
when you're
numbers.
feeling good.
Especially when you're feeling good. Look at your
Get
numbers.
a baseline.
Estrogen, progesterone, testosterone. Those are the three
And
really big.
thyroid.
And the thyroid. Ask your doctor and just get your numbers, mark it down, put it in a file on your folder and say, this is when I feel good. And there's a lot of women going, oh, well, I know about like functional doctors and naturopathic doctors, but is there a database that they can find someone in their town you said there's not a lot of people who are
Unfortunately
trained?
not, but there is a company called Bioty. And Bioty makes pellets, hormone pellets, bioidentical hormone pellets. And they have, and they're pretty much in every state, and people can search for a Bioty provider near me.
Okay.
And that would be at least a doctor that is addressing hormone replacement therapy. The one thing that I'll say, just to keep an eye out, is, at least this is just me, and I don't want to undermine Bioty, because I use Bioty. I love the company. I love their products. But they are training. It's not just gynecologists and people like me that are interested in hormones. Other doctors are as well. ER doctors, so they're training doctors in other specialties and nurses and nurse practitioners and a lot of med spas on how to do hormone replacement therapy, because everybody's wanting to learn. So, but what I would recommend for patients that are new to this, that are looking for a Bioty provider near me, they'll give you a list of them. Open up that list, look at each doctor's name and the specialty. So if it says like whatever, Susan Smith, OBGYN, or look for ones that are actually doctors, not in a med spa. And you'll be
in good hands.
Okay. Even in a med spa, you'll be in good hands. It's just a different vibe. Like for me personally, maybe I'm speaking for myself personally. Like if I'm dealing with a medical issue, I don't want to be going where, the whole place is Botox fillers. And
for sure.
And I'm just kind of in a back room to the side by one nurse that is
Right.
the one lady that was trained that, it's just, I think for right now, that if you're new and naive to hormones, that you want to be under a medical doctor that's there. See, in med spas, there's no MD there. These are nurses working under the medical license of so he's not even there. And so
go
if
to a
things
spot.
if things go awry, or if you have, it that's just my preference. And it's easy to do. And the Bioty providers can draw your hormone levels, talk to you about hormone replacement therapy, and give you the options. And hopefully, like patients come to me, like Bioty is not the only option for hormone. There are other options, like because the Bioty is a pellet, which is implanted. And not everybody wants that, or not everybody tolerates it. Not everybody can afford that. By the way, they're not covered by insurance, so there's a cost. So, it individually tailoring treatments to meet each woman's specific needs, her medical needs, her financial needs, her emotional needs and goals, is important. And maybe that's why it's not covered by insurance, because the way that medicine is now with managed care, the doctors have 15 minutes. They have to see 30 patients a day on a 15-minute slot. You can't do that with menopause. I have to spend like at least an hour with a new patient, going over everything and then explaining everything, and then so if I had to do that under insurance, it would, it would,
you wouldn't make any money.
work.
You're nothing. It's just not a format that would even fit.
Because I'm not seeing 30 patients today. You see 8. So then 10 are here. Then I need to clone myself. So that's the challenge that gynecologists have, that especially the new ones that are still delivering babies and still taking insurance, that and insurance isn't reimbursing them properly, so they can't spend the time. So then women are going outside of their primary care provider to alternative medicine doctors, to holistic medicine, to
Yeah.
acupuncturists, to these other places, but they're having to pay out of pocket.
Yeah. As the last part of this, we talked a lot about those hormones, the bioidentical. It's wonderful that you're bringing them to light, because maybe we spoke about them years ago, but now we have them really like the most updated, and
Mhm.
plus the testosterone part. Is there anything else, lifestyle, anything that really has helped you or your patients that, okay, outside of these hormones, here's some really important stuff also to do
Mhm.
for your menopause journey?
There's two things. One thing that I know about and practice myself. There's another thing that that I don't know about, that I have to learn about. Actually, I'll tell you the thing that I don't know about that I have to learn about. Just like other doctors are learning about
Yeah.
hormones, I don't know anything about plant-based medicine, and plant meaning psychedelics, or like the whole thing of microdosing,
Yeah.
and also ketamine. I'm
Mhm.
not an expert in that. Now, I actually don't even have a referral base of where to send women for those therapies, and so that's new to me, and something that I'm learning about and reading about, and that patients are doing, and I'm seeing the benefit of it. But I haven't experienced it personally, and I haven't done enough. I mean, I've done research, but not enough to at least talk about it. But I do think that that's going to play a role. That those therapies will play a role in this. And so the other thing, if you said what do I do know,
Yeah.
is I know about your self care and your mind and your thoughts, and what I've um, learned over all this time that I'm practicing is that when women buy, like, all they have to have is a seed of hope. Like, a lot of them have been to 15 other places. That, now today we're getting them like every Tom, Dick, and Harry. But back in the day when I first started, I got the like broken cases that they had
Yeah.
seen everybody else, and this person had tried this, and this person they had seen, and the what I realize is that if I can just impart like one small, like, for them to believe, okay, this lady sounds like she knows what she's talking about. Granted, I have a lot of fear and I'm not totally trusting, but I'm going to give it a chance. I'm going to buy her story, and I'm going to try this. So that one little seed of hope is all it takes to, for the beginning of transformation.
Mhm.
It's so when there's resistance, or when there's fear, when they go, this isn't going to work, and that's, or I'm not, or patients, I'm not going to do this, or she told me, when that voice, when you allow that voice of fear, like Inside Out,
Yeah. Yeah.
the
Yeah.
fear, anxiety, whatever her name was,
Yeah.
when that voice gets loud, that impacts your health and well-being. So I talk about meditation. I have different meditation tapes. I have retreats and groups, and all sorts of things that I encourage women to take part in. And most of them totally get it. Like today, I think, when we're talking about mind body, like, everybody understands. And now that we're starting to understand that the way that we think can impact every cell, every organ, every gland, everything in our bodies. And I elevate the placebo effect. Like, it doesn't matter to me whether it's placebo or
Yeah.
whatever matters. Like, if you think and believe that this is working, it's working, and that your perception is reality. So I guess that's been my growth, my personal growth over the decades, and then also my personal growth in terms of mental health and meditation and spirituality. So that comes across in my treatments, and that's imparted and delivered to them, which I think helps to, or has helped to, optimize my results and
Yeah.
success. Like, I don't know whether it's me or the hormones or
Right.
just being
Maybe
part of
both.
it that makes them all better, but I don't have any failures. I have people that had to go off, that have fibroids and bleeding, and they just can't do it. In those cases, but ones that can tolerate it, and ones that, like, they're happy.
Beautiful. A lot of hope out there for
Yes,
women
there was hope.
undergoing perimenopause, menopause, and I know it can be very difficult. I remember my mom going through it. So it's like every kid out there remembers.
Yeah.
How can the audience find you?
So for more information, they can go to my website, bermansexualhealth.com. All right, my Instagram is @JenBermanMD. We have a Shopify account too, a shop associated with the website where women can learn more about the Menopause Biotype test if they want to learn more about the biotype and find out what their risk factors are and what they can expect. They can do that too.
Beautiful. Thank you for sharing this with us. I can hear your passion, and it's beautiful that you've had your own experience so you can really speak firsthand and be supportive to so many women that it seems like the medical industry has forgotten, like you said. But you being a leader and a voice for it is really powerful. And I'm so happy to have this as a real first perimenopause, menopause talk.
Yeah.
And all the women out there, sorry I did it. It took so long, but we got it out there for you. You're empowered. You know where to go. You got some information. Thank you for coming on the show.
Thank you for having me.